name is Michael Steele. It's a pleasure to be with you here today. And I'm going to go ahead and share my screen so that you can see the presentation here. Is everybody seeing the Alera Group logo?
Yes.
Okay, so we will get started without any further delays. Again, Michael Steele, I started a little agency. It's going on 20 years ago, centered around Medicare. And over the years, we've kind of developed it and grown it into some other things, but we've always been very heavily invested and focused on the Medicare insurance market. And so, I've got a number of years of experience in this field. And about 3 years ago, we joined with your benefits broker, who is Alera, that's sponsored through your employer. And so that's the connection. And so this is a value add for you as the employees to hopefully glean a lot about Medicare today and learn a lot from someone who's been doing it a lot of years and doesn't cost you anything but your time and your inclination. So really glad to be here with you today, and we will go ahead and get started. I will ask you, if you don't mind, if you could save your questions for the end. My presentation normally takes me about 35 to 40 minutes or so. So what I'd like to do is go ahead and get through all that. I would say 90% of your questions will be answered in the presentation. And I appreciate your patience. When we get to the very end, I will open it up for question and answer. So if I didn't answer your question throughout the presentation, or something didn't make sense to you, or you just need a refresher or something, you let me know at the end, and we'll certainly answer all your questions and show you how you can get in touch with my office for an individual consultation if that's what you need. Today's agenda, we're going to go over transitioning from group insurance into Medicare. What does that entail? How does it work? We're going to talk about Medicare. We're going to break Medicare down for you and go through the 3 or 4 distinct parts of Medicare and what each part covers and how it works in practice. Okay? We're also going to overview supplemental and or Medicare Advantage plans. These are the plans that go alongside your Medicare that will cover the amounts that Medicare leaves off for you. What are your rights and responsibilities under Medicare? This is very important. You need to have a basic understanding of when you need to enroll in your Medicare, because off timing can cost you dearly in the long run. It can have some really negative implications for your eligibility, as well as potential late enrollment penalties that we want to try to avoid. So we're going to talk about all those potential pitfalls today, okay? Finally, how we can schedule a consultation. So if you're interested in having a spouse or another loved one or a friend or something talk to us, we will be more than happy, we'd be delighted to schedule a one-on-one consultation with you or a loved one. Original Medicare, what is it and how does it work? Medicare was signed into law back in the 1960s. Actually, Lyndon Johnson was the president at that time. He signed Medicare into law. Healthcare was a whole lot different back in the 60s than it is today. And so over time, there's been incremental additions to Medicare over the years and over the decades. When it started, there were no life-saving, life-altering medications, right? Over the last 15 to 20 years, we've mapped the human genome, and as a result, biotechnology has gone exponentially higher. We've been able to create some amazing life-saving medication, but these medications and these treatments weren't around in the 60s. So when Medicare was signed into law, it was just good old hospital and medical. Um, Now you have hospital, medical, and prescription drug coverage. That was added in 2006. Prescription coverage was added in '06 with the Medicare Modernization Act. What's more, original Medicare was signed into law, decades ago before anybody knew what an HMO or a PPO network even was. Those were formed back in the 80s. So back in the old days with healthcare, if you bought a health plan back in the 60s and 70s, chances are it was an old school indemnity policy. And that terminology, indemnity, that means that the policy would pay a stated amount like a life insurance contract. The policy would pay a stated amount, not a dollar more, not a dollar less, for hospitalization, for surgical, for doctor visits, etc. And that's kind of how original Medicare was set up. Original Medicare is a national fee-for-service framework whereby you can see any doctor, any hospital nationwide where Medicare is accepted. There is absolutely no network with original Medicare. Isn't that nice? Isn't that refreshing? Chances are at work you have a PPO, which great, PPOs are great. HMOs are okay in certain circumstances, but I kind of shy away from HMO because you're really limiting your choices of providers and you don't have any out-of-network benefits associated with an HMO. Typically, broadly speaking, HMOs are a very restrictive network. So hopefully, this gives you some good context and opens your eyes to just how valuable this can be when you have a national fee-for-service model. You can see any doctor you want. As long as the provider accepts Medicare, you can go see that provider with your original Medicare, which is phenomenal. And original Medicare is comprised of three distinct parts. Medicare Part A, which we're going to break down here in a minute, is your hospitalization. Medicare Part B is your medical insurance. This is how the government differentiates the parts of Medicare. And then finally, Part D, again, is your outpatient prescription drug coverage. And the confusing thing about original Medicare, particularly when you first get signed up for it, is that Part D is a separate standalone plan. So unlike your group insurance at work, whereby you have your hospital and your medical and your prescription coverage integrated into one distinct policy, with original Medicare, your Part D is separate. And that's what we're going to break down into more detail here in just a minute. So let's dissect Medicare a little more closely here. So there are three parts. Part A is your hospitalization. Part A is free of charge to you or your loved one, as long as you or a spouse have worked the requisite number of quarters throughout your working history, which amounts to about 10 years of work history. As long as you paid into the system for 10 years or longer, then you automatically qualify for Medicare Part A when you turn 65, and there's no monthly premium associated with this Part A hospitalization. The SNC that you're seeing on the slide, that stands for skilled nursing confinement. So this skilled nursing confinement is similar to a hospital setting, and Medicare covers the first 20 days of skilled nursing in full, no out-of-pocket costs for you. But beyond the 20th day through the 100th day, Medicare assesses a daily what's called coinsurance amount, that you as a Medicare beneficiary would be responsible for. Hospitalization, Medicare generally covers 100% of your hospital cost, aside from a per admittance hospital deductible. And Medicare's hospital days are cumulative, meaning Medicare adds those hospital days. And once you reach a lifetime reserve hospital days of about 60 days, from 61 through 90 and 91 through 150 in the hospital, Medicare is going to assess a very, very expensive daily coinsurance amount that you're responsible for. And so for these reasons, that, if it's in the event of a catastrophic event, you are highly advised to have some sort of supplemental Medicare health insurance that we'll dig into in a minute in more detail, but that is designed to cover these amounts that Medicare does not cover on your behalf. So the idea is that whatever Medicare leaves off, your supplemental insurance will pick up on your behalf, leaving you with very little, if any, out-of-pocket cost. Part B is your medical insurance services. Anything under the sun medical related falls under Part B, i.e. doctor visits, surgical procedures, durable medical equipment, anything that really does not fall under a hospitalization is going to fall under your medical services, whether it be inpatient or outpatient. And this is much easier to understand the structure of Part B. This falls under the famous 80-20 split. And by that, I mean Medicare pays 80% of all of your Part B Medicare eligible charges for as long as you live. And you or your supplemental insurance, if you have supplemental insurance, is designed to cover that 20% that Medicare leaves off. Okay. There is a deductible under Medicare Part B. Unfortunately, I do not quite yet have the 2025 numbers yet. Those will not be published by CMS Medicare until, we probably got a week or 10 days. They normally publish the new premiums and deductibles and coinsurance amounts the first week or two of November. So if you care to, you can call my office. We'll be delighted to send you, when it's made available, we can send you all of these new numbers in kind of like a cheat sheet format that Mr. Johnson here was kind enough to prompt us to create. We actually will probably get that updated in the next 20 to 30 days and have that available for you as a very quick reference tool that you can open up and you can see, oh, okay, here's my Medicare premiums. Here's my deductibles under Medicare. Here are, just some basic information about Medicare that will help you make an informed decision. As it stands this year, the standard Medicare Part B premium is $174.70. IRMA considerations with Medicare Part B. IRMA stands for Income Related Monthly Adjustment Amount. I just want you to know, without wading into the weeds of all the detail, that Medicare premium for Part B is means tested. What that means is if you or your spouse file a joint tax return and your income happens to be over $200,000 a year, you will be assessed a higher Part B premium than this $174.70. Okay? If that's a concern for you, again, call my office. We have or you can Google IRMA premiums, Medicare Part B premiums. You should be able to find very easily the IRMA premiums and what you would pay based on your specific adjusted gross income, and it's based on your AGI, your adjusted gross income. That's basically your income before you take into account very many deductions at all, before you take into account your standard deduction or any deductions. That is your gross income, essentially. Part D, again, is your standalone drug coverage. This was added in 2006 with the Medicare Modernization Act, purchased through private insurance companies that have a contract with CMS Medicare to offer your prescription drug coverage. One thing I will tell you that's brand new, and I believe I had briefly touched on it with your colleague at your employer, but one thing I will tell you about 2025, President Biden signed 3 distinct pieces of legislation, major pieces of legislation, one of which was called the Deficit Reduction Act. You may have heard of it. There were many, many provisions in the Deficit Reduction Act to help lower the cost of your or your loved one's medication. In years past, there was a high coverage gap in drug coverage called the donut hole. So for these unfortunate people who, were taking Eliquis and Farjexa and some of these really expensive medications that don't have a generic, now for the first time ever, these medication costs will be capped at a total spend of $2,000 per year. So that means if you're one of the unlucky people that has Eliquis and Eliquis is $600 without insurance, guess what? Your total drug bill, with your premium included, will be capped at $2,000 for the year 2025. This is a godsend. This is a great thing for a lot of folks out there who have some expensive medications that cannot afford those medications. So again, I'd encourage you, for all the details, I'd encourage you to just give our office a call. We will be more than happy to set up an individualized, tailored, one-on-one consultation where we can go through all this in detail. We have very robust quoting software that's geared to this Medicare insurance, where we can plug all your medications in, and our system will shop all 29 standalone drug plans or plans that are integrated with the Medicare Advantage coverage, which we'll touch on in a minute. We carry both. We write Medicare Supplement. We also write Medicare Advantage. So we will take the time to spend with you or a loved one to make sure we thoroughly shop the market impartially to recommend the most competitive options available for you. We're contracted. We're an independent agency. We're not married to one company. We are contracted with dozens and dozens of insurance companies depending on the product. So I've developed those contracts over 20 years of being in this business. So we will, to serve you better and to be able to offer you solutions to your individually tailored issues that you may have. And so we're delighted to do that for you. We've kind of touched on this in one of the previous slides. I will quickly review this. Part A, again, is your hospitalization and skilled nursing coinsurance. What you need to know about hospitalization and skilled nursing is that Medicare pays the bulk of your expenses, but they certainly don't cover everything. And if you get in a situation where you get really sick and you're in and out of the hospital frequently, like some people are, you don't have supplemental or Medicare Advantage coverage to backstop your Medicare, you could be out tens of thousands or hundreds of thousands of dollars even. And so one thing you just need to know is that this Medicare supplement coverage is very valuable because it's designed specifically for this reason, to cover all or a big portion of your Part A gaps, okay? Part B, again, is the famous 80-20 split I touched on. Again, the supplemental insurance is designed specifically with this in mind to cover the 20% that Medicare leaves off. If you have a certain Medigap policy, you may only have a $240 to a $250 total out-of-pocket spend.
Enter your meeting ID followed by.
Okay, so this out-of-pocket spend of $240, this is your annual Medicare Part B deductible. This is all you're responsible for with, quite a number of these federally standardized Medigap policies, which is really nice because, in this day and time that we live in, it's quite difficult, really, to find a health insurance plan that only has a $240 out-of-pocket spending limit. Most times your insurance is $3,000, $4,000, $5,000, can be more in a family situation. So this is very, very good news and a peace of mind for a lot of seniors on Medicare on a fixed income that can't necessarily afford $3,000 to $5,000 worth of out-of-pocket exposure. And finally, Part D is the prescription coverage. This is a formulary. This is a tiered formulary. And by that, I mean your medications are going to be classified as either generics, which would be tier 1s and tier 2s. Name brand medication would be tier 3s. And your preferred name brand or your high technology medication would be tier 4 and tier 5 drugs. Those are the very expensive medications that normally don't have a generic alternative associated with them. This deductible of $545 was the maximum deductible this year. That's actually gone up to $590 for next year. So that is one update I can share with you at this particular moment in time. We have found out that the Part D deductibles have gone up to $590. So what are your options under original Medicare? So what I've alluded to in previous slides are what's called Medigap policies. These are Medicare supplement insurance plans. These were federally standardized in 1992. So the feds got together with all the state insurance commissioners in all but 3 states, and they decided to federally standardize this Medigap coverage. So it's very transparent for you, the consumer, makes it very easy for you, the consumer, to choose a plan because they're only sold in plans A through N. They're identified by letter. So whether or not you live in Idaho or Texas or California, or whether you have Blue Cross Blue Shield or United Healthcare or Mutual of Omaha, you will see the exact same federally standardized chart, which is that's good news. That's great for you, the consumer, because you know exactly what you're buying, right? The go-to plans for this year and next year, I suspect, are the Plan G and the Plan N. If you have a Plan G, back to that previous slide. Oop, other way. Back to the previous slide. If you have a Plan G, all you're responsible for is that $240 annual Medicare Part B deductible. So that's what I alluded to by saying that may be your maximum out of pocket. That's essentially with the G plan, that's essentially your out of pocket. Isn't that nice? You don't have a copay when you walk in to see a doctor. You don't have a hospitalization deductible to satisfy. You don't have any other exposure for any Medicare approved charges under hospital Part A and Part B, except for the $240 deductible. And another really nice thing, really valuable piece of all this, again, is original Medicare's National Fee-for-Service framework. That means this supplemental insurance has no networks. The supplemental insurance, Plan G, Plan N, doesn't matter who you have. You can have Mutual of Omaha, you can have United Healthcare, you can have Blue Cross Blue Shield. As long as the provider accepts your original Medicare, your Medigap policy is accepted wherever Medicare is accepted. Okay? What's more, this Medigap policy is guaranteed renewable for life. This means regardless of what happens to your health, or regardless of what Social Security and Medicare do to decide to do to change the structure of original Medicare, the policy can never be changed. You can never be charged a higher premium than your neighbor down the street. And you are guaranteed to be able to renew your coverage without any changes for as long as you live. That's valuable. So that means if you develop a pancreatic cancer claim or something really serious, your insurance company cannot drop you. Your insurance company cannot charge you 1,000% more for that policy and push you out of that policy by default because you can't afford it. That's illegal. Okay. So very valuable, very peace of mind that you have a policy that you can never be taken from you other than just simply not paying the premium. If you decided not to pay the premium, excuse me, or were late in paying the premium, legally your insurance company can drop you. So for that reason, we always recommend a monthly bank draft. I can't tell you how many clients over the years have called me in a panic because the hospital was literally kicking them out the door because their supplemental insurance was not activated, and come to find out, they took themselves off of the bank draft and they neglected to pay their quarterly premium payment in time. Well, after 30 days, when the insurance company doesn't receive the funds, guess what? They can cancel your coverage legally. That's their right when they don't receive the money in 30 days. And so again, other than that reason, you can never be canceled. So for that, for your protection, we always recommend a monthly bank draft. Finally, the premiums, these do have premiums associated with them. They are not zero premium like a Medicare Advantage plan is. So you will have a premium. These are currently being rated based on area, gender, tobacco usage, and the like, and age. Okay. And again, we can get into specifics when we schedule a one-on-one consultation. We will be more than happy to quote you 20 different companies. We'll just do that individually, one-on-one. Medicare Advantage. Now, so far we've talked about original Medicare. You remember back to the beginning when I said the Medicare Modernization Act was signed into 2006, way back in 2006. Part D was added to Medicare. Well, the other part that was created and enhanced was this Medicare Advantage program. Medicare Advantage, simply put, is a private alternative to the original Medicare program that Lyndon Johnson signed into law back in the 60s. So it's a modernized version of the original Medicare program, whereby when you sign up for a Medicare Advantage plan, okay, you are effectively removing yourself from original Medicare and you're going under a private insurance company like a United Healthcare, Cigna, Aetna, Blue Cross Blue Shield. All these household names you've heard of before offer these plans in the private market individually. under a Medicare Advantage contract. These plans are like apples, and Original Medicare is like the orange. They're two different animals altogether. A Medicare Advantage plan is going to be networked. These are either going to be PPOs or they're going to be HMOs. And again, you can tell already I'm not a big fan of HMO. Knowing what I know about HMOs, you essentially have one doctor and a tight network of hospitals. You cannot go out of network. The insurance companies will not pay 1 red cent out of network. So right now in this season, we're right in the middle of open enrollment. The annual enrollment period, as it's called, applies to this Medicare Advantage business. That's why you're seeing JJ on the television commercials or Humana, belaboring, beating you to death with all these television commercials right now, because they know they have to enroll you by December the 7th is the deadline. If they don't do the enrollment by December 7th, it's all over again for another year. So these Medicare Advantage plans, they have an enrollment period. They're network plans. They have high out-of-pocket costs associated with your health care. So if you get real sick, buyer beware. This is not what you hear on the television commercials. You have anywhere from, on the low end, $3,000 out of pocket if it's an HMO in network, all the way up to $11,000 to $12,000 out of pocket if you have a PPO and you opt to go out of network. So as you can see, what I always recommend, what I have my parents on, is a Medigap policy. Yes, it costs an extra $100 a month in addition to the Part B premium of $174, but much more valuable. My mother needed a surgery on her neck. She didn't want to have just any old surgeon do the surgery. She opted to come to Houston to have Dr. Leahy, who is world famous, the best of the best doctors, to perform this surgery on her neck. She was able to come to Houston from the San Antonio area and have this surgery no problem. Dr. Leahy takes Original Medicare. He does not take any Medicare Advantage plan. So hopefully that gives you some good insider information, some context to why we recommend Original Medicare over the Medicare Advantage. But nevertheless, we offer both. In situations where you have a low-income individual that simply cannot afford the $100 a month, something is better than nothing, right? So if you are a loved one or your family member is low income and just cannot afford the $100 a month for the Medigap policy, we would encourage you to give us a call. We can shop those plans and get them the best of its kind. But broadly speaking, generally speaking, we recommend Original Medicare for that sole reason right there, is that you can see any doctor or hospital without a referral, without a networking with the network, and overall, more providers will accept Original Medicare than will sign on to take a reduced fee under a Medicare Advantage contract. However, many of these Advantage plans do have additional benefits. And this is what you're seeing on the television commercials. You are seeing all the frilly stuff, all the really good stuff, and they're glossing over all the negatives. It's not like they're lying to you, but they're not fully disclosing in the television commercial what the pitfalls are, namely the high out-of-pocket costs we talked about, as well as the networks. So, but nevertheless, they do have additional features built into them that Original Medicare does not have. Gym memberships are typically included, vision, hearing aids, dental, some limited dental. All of these things can be integrated along with Medicare Part D, The prescription plan is not a separate standalone plan like you have with the, like we discussed with original Medicare. So with the Medicare Advantage plan, you'll typically have, it's an all-in-one plan that looks very similar to what you have at work, chances are, whereby you've got your hospital, your medical, your prescription, your gym membership, a little bit of dental and vision, kind of all wrapped up into one policy. Okay. I believe we talked about this. 0 monthly plan premium. Many of these Advantage plans do not carry a premium. You may say to yourself, well, golly, how is that possible? How can my insurance company give me all this hospital, all this medical, all the gym membership, the dental vision, on and on and on for 0? Well, it sounds too good to be true, but it really, in reality, the way it works is when you sign up for an Advantage plan, CMS Medicare transfers the risk off to a private insurance company by way of a contract. So CMS Medicare, the federal government, is paying your Medicare Advantage provider $1,000 a month to insure you. That's how the Advantage provider can give you all these benefits for a 0 monthly plan premium, because the federal government is transferring the risk by way of consideration, i.e. a monthly premium, to your private insurance company. That's how you get all of this for nothing out of your pocket. Again, buyer beware. These plans look appealing. They have a 0 premium. They are more cost effective. But if you get sick, you're going to have anywhere all the way up to $12,000 out of pocket. Certain providers don't take it, like MD Anderson Cancer Center. They don't take advantage. A lot of providers like Dr. Leahy, they don't take advantage. And again, these are contracted with Medicare to offer your coverages under a networked contract, contractual arrangement. In and out of network cost sharing restrictions that we have already touched on. Now, what are your rights and responsibilities under your Medicare? When you turn 65, everyone has the opportunity to enroll in Medicare A and B. It begins the first day of the month in which one turns 65, okay? The exception to this rule, and what I want you to very clearly understand, is your employer needs you to not enroll in Medicare Part B. Part A is okay. You can enroll in Part A, but you want to defer Part B until you retire. Whenever you retire, then and only then are you going to enroll in Medicare Part B. That's done through the Social Security Administration. You either pick up the phone or you go on to ssa.gov, or you can call us. We have all the forms. We hold your hand. We provide you with excellent customer service. We will guide you the whole process, the whole way through. But just understand, if you're turning 65 or nearing 65 and you plan to work full time indefinitely or up to age 70 or 68 or whatever your full retirement age is, you want to defer Medicare Part B. You don't really need to enroll in Part A either. Okay, you want to defer Medicare. You don't want to enroll. You want to maintain your insurance at work, okay? Whenever that day comes when you're ready to retire, give us a call. We'll walk you through the process. We'll help you get Medicare set up properly. And then, of course, get you set up with all the appropriate supplemental and or standalone drug coverage that you may need to cover your individualized needs, okay? There are special enrollment windows. So if you're planning to work full time and you're carrying your employer plan, you just need to understand You don't need to dilly-dally. You don't need to delay your Medicare enrollment. When you do ultimately decide to retire, you really need to give us a call or get with the Social Security Administration at least 60 days in advance of your planned retirement date. You need to go ahead and do the enrollment in your Medicare 60 days in advance of the day that you plan to retire and come off the group insurance. Reason being is it takes Medicare at least 30 days, 40 days to get your red, white, and blue Medicare ID card out to you. That Medicare ID card has a very specific identifier number on it that we need in order to do the Medicare supplement and or prescription drug plan enrollment on your behalf. We have to have that Medicare ID number for you to be able to access your Medicare supplement benefits, okay? So you have a 63-day window of time in which to enroll in Medicare Part B without any penalties or late enrollment penalties or worry about going without Medicare coverage. But you just need to understand you only have 63 days from that qualifying event. Otherwise, you may have to carry COBRA for a while. And I know COBRA can be very, very expensive insurance after you retire. So we want you to try to avoid the high expenditure and to, access your Medicare benefits when you're truly eligible. Now, if you have a spouse or a loved one or a referral that is nearing or in retirement on 65 or older, we encourage you to give us a call. I believe your employer, due to the fact that the insurance premium is very, very expensive for someone over 65, we would highly encourage you to give us a call for your spouse or your loved one. We would be happy to quote them, probably likely at a fraction of the cost that they would spend if they were enrolled in the group health insurance plan. Okay, I hope that helps. Late enrollment penalties. So again, if you are 65 and you don't have employer-based group insurance and you just don't enroll in Medicare when you're eligible, huge penalties, big waiting periods, big no-no. You don't want to do that. You also don't want to just, wait too long to enroll in Medicare when you retire and go on to Medicare A and B. You don't want to wait too long. There's big penalties and you could suffer through many, many months without insurance coverage before Medicare will activate your Part D and your Part B Medicare benefits. So you can just kind of keep that general idea in mind. If you or a loved one does not have employer insurance, you've got to enroll at 65. If you have employer insurance, keep it, maintain it as long as you're working full time. Whenever you go part-time or you retire and hang it up and move out to a Caribbean island somewhere, then give us a call way in advance, 60 days in advance. We'll get you taken care of. Okay? Great. Medigap, the Medicare supplement plans that I was talking to you about that I have my parents on, very valuable. They're guaranteed renewable contracts like we talked about. But outside of open enrollment, and you're in open enrollment when you first activate your Medicare Part B, whether that happens at 65 or whether that happens later on when you retire at 69 or 70 years of age. Okay. When you finally retire and you activate B, okay, that generates a special enrollment guaranteed issue period for you. But it only lasts 6 months. After 6 months, if you develop a pre-existing condition, we may never be able to get you on another Medicare supplement ever again, depending on the severity of your condition. These are underwritten policies outside of open enrollment. So that's why it's very important, in my view, to choose wisely on a plan, to consult with a trusted advisor, broker like myself or my team in my office, because choosing the wrong plan could have long-lasting negative ramifications for you that we want to try to avoid. So that's part of the service that we provide. We shop the market. We provide you with very good insider information that you won't get on the television commercial. JJ, I'm sure he's a great guy. I love JJ, but he's not giving you the full picture. Those plans on television, like Humana, they're not giving you the full picture. If you get in on one of those plans, you may never be able to get out from under that plan and purchase something more valuable like a Medicare supplement policy. So again, it's very important for you to get solid, honest advice from a trusted advisor. Whether, I don't care if it's me or somebody down the street. I could care less. I've been doing this long enough. I've made plenty of money. I don't need to make a sale. I get satisfaction and I get pleasure out of doing the right thing for you, because it makes me feel good when I know that I've done the right thing for the client, because then the money will follow, if that makes sense to you. I learned that a long time ago. So I hope that helps. That's about, I mean, hopefully that gives you some really good insider information, some information that you probably won't get very much else of unless you really dig into it and do your homework and study an outline of coverage. You got to spend hours reading this stuff. I hope that helps. It's been about 48 minutes. I'll open it up to questions. If anybody has any questions for me, I'd be delighted to answer them for you or review something that may have not have made sense to you.
I have a question. Does Methodist take the Advantage plan?
Great question. Yes, ma'am. I would need to get into my software. Are you talking about like Methodist?
The hospital.
Oh, yeah. Yeah, there's some that they absolutely do. There's some PPO plans, Medicare Advantage plans in particular that look pretty good. In an individualized, I'm not allowed, unfortunately, per Medicare has a lot of rules. And this is designated as an educational event, and I can speak in generalities, but I can't go into too many specifics without having you sign a form and doing an individual one-on-one. Okay. So, but I can't answer that question. I just can't give you, plan specific information on this particular call.
Mm-hmm.
We can on an individual call. I can give you plan specific information, but yes, ma'am. Broadly speaking, yes. Methodist, there are some plans that would accommodate you there.
All right. Thank you.
Sure. If anybody would like to take down my my number here to the office and our website, where you can go in and check out our team, check out us, give us a call for an individual one-on-one appointment. My number is 281-255-4444. And again, my name is Michael Steele. I'm a CFP. And my website is www.ihsinsurance.net. So there you go. You've got my basic information. If you have any other questions for me now, I'd love to answer those for you.
Hey, Michael,
if not, we really look forward to speaking with you. Yes, ma'am. Oh, yes.
Yeah. Question, I'm thinking about a scenario where you've got, say, an employee or a plan participant who's active, they're still working, say they're 63 years old, and they've got a spouse that's 67 or 68, okay?
Sure.
So you've
Right.
got a spouse that's already beyond 65, but is still being covered by the active participant's medical plan.
Mm-hmm.
Would it be, in most of the cases you've seen, is it more cost advantage for the individual who is over 65 to leave that plan and go ahead and get on Medicare?
Without a doubt. Not 9 times out of 10. Medicare Part B is 174. The supplement, give or take, is, let's call it $100. That's, so for 300 or less total, including the drug coverage, you're covered where you can go to any doctor or hospital you want, and you've got a $240 out-of-pocket maximum. You don't even have a copay when you walk in to see a doctor.
Okay, got it. Thank you.
Oh, you bet. Yes, sir. So, most of the time at that age, the group insurance is anywhere from what, better than I do, $600 to $900 a month just for a spouse.
Yes, correct.
So, yeah. So, it's typically Medicare with, the total walkout premium is a third of what the group insurance cost.
And Michael,
And see, used to, the one drawback to Medicare was that it was great on the hospitalization and the medical. I mean, let's face it, it's hard to find a $240 maximum out of pocket anywhere, much less group insurance. But where it really was not very advantageous for the consumer who was taking expensive medication was on the Medicare Part D. Because when the Part D came out, it was created with this coverage gap called the dreaded donut hole. So it had this huge coverage gap where if you fell into this donut hole, you had to spend 100% of the cost of the Eliquis that was $600 a month or $1,000 a month until the insurance would kick in again when you got into the catastrophic level. Well, that's been done away with the Deficit Reduction Act. Now, everybody, no matter how much or how little they make, income-wise, is subject to a $2,000 annual cap. That includes the premium that they may be spending, their deductibles, and all their copays cannot exceed $2,000 for the year 2025 and beyond. So even now, the prescription plan is on par with the commercial group health insurance plan. So I hope that helps give you some more context. But
and Michael,
yeah.
I have a question that's Godfrey. What's the most efficient way to get signed up for Part B? Straight online with Social Security, going to the office? I assume, I've heard different stories, and that they're more than 60 days behind now, that it could be as much as 90 before it's processed. What is the most efficient, time efficient way to get it done?
Yes, sir. Is the person you're referring to a computer person? Do they have easy access to a computer?
Yes.
Okay. You might write this down, ssa.gov. That stands for
Right.
Social Security. Okay. That's the easiest way. Click on, they've revamped the website. It's so easy to use. It's user-friendly. It's simple.
Is there, after the initial one, where do we go to?
You go to ssa.gov. At the top, I believe it says Medicare. Hover over Medicare, a drop down will come down. And then I think it's apply for Medicare.
Okay. We'll
And
figure
you're
it
off.
out. Okay.
Yes, sir. And if If you or a loved one has never established an account in SSA, Social Security Administration, before, there's some identity proofing involved. So that would entail, answering a series of credit related questions that only you or the person involved would know about. Once those questions are answered, then the system automatically creates an account for you on your behalf. It prompts you for a username and password. Once that's done, then you simply sign up for Medicare. You want to enroll in Medicare only if you plan not to draw Social Security at age 65. If you plan to put Social Security off to full retirement or even later, then you need to apply for Medicare only. That's the distinction. Does that make sense?
Yes, thank you.
Great. My pleasure. Let's see, ssa.gov. Right in the middle of the homepage, everybody, there's an apply column. And right under the apply column is a sign up for Medicare hyperlink. You just simply click on sign up for Medicare and you're off. You're off to the races. If you already have an account, I don't think this takes you more than maybe 10 minutes, 10 to 15 minutes on the Social Security website, okay? So it's pretty easy to get done. I hope that helps.
Michael, I'm Pam Woody, and I was the one that Mark Helms was talking about, probably.
Oh, okay.
Else.
Hi, Pam.
Maybe.
Yes.
So I have already applied for the Part A Medicare when I turned
Okay.
65. But what I want to know is, how is this going to affect, because this last year we just now started with the high deductible plan and opened up an HSA account. So if I decide to enroll as the spouse into this Medicare Part B and D, and if I can find that they can have, I don't do a lot of, need a lot of medication, but how will that affect the HSA? Would my husband still be able to, would Steve be able to still have the HSA account for him, or do I not? How does that work?
That's a great question. And I'm so glad you asked that, because let's face it, a lot of people nowadays, with the rising cost of healthcare, a lot of people have these HSAs and they're a great fit for so many people. The one drawback with an HSA is, I kind of had to do my due diligence years ago on this, and it's not easy to find. And there, I really had to do some digging. But apparently, the IRS may penalize you if you have contributed, and I'm speaking for you, Pam,
Okay.
not necessarily for you, Godfrey, but for Pam individually, if you have contributed to the HSA account, the tax deductible savings account, right? Not the policy, but the savings account portion within 6 months of your Medicare date. Now, what I would encourage you to do is to get with your tax preparer.
But that's me.
Oh, wow. Okay. Well, then, yeah.
I do the taxes. So,
Okay. Do you know what the penalty is, Pam?
Well, so I know what the penalty is, but the account is set up in his name. So
Okay,
it's his account, and so it's all in his name. When I set that account up, it was only his name, his Social Security, everything about it was just him. So it's not my account. I don't have one personally, but it's all through him. But in the last year, with the high deductible plan, some of my medications, and I haven't and it's all been paid after, so just have the receipts, so it's not like I have to claim them all. So what you would be suggesting is that I can't claim within the last 6 months any medications that I would have used out of that HSA.
That's what I'm suggesting.
Okay,
That's what
all right.
I would look into. I would
Okay.
put your tax professional hat on and you know, and get with
Do the
someone who's a
research.
professional, a CPA or something,
Yeah.
because here's why. The IRS says an individual can contribute a maximum of $4,150 to the HSA account.
Oh, yeah.
A family group, meaning 2 or more individuals, right, can contribute 8,300.
Right.
So if the account is under your husband's name or you know your partner's name,
My
uh,
husband.
right, then and you're and he or she is contributing more than the individual amount, then that amount in excess of the individual amount, in my mind,
Is
could
subject to.
incur a penalty. Right.
I see.
So
Wow.
what you would want to potentially do is find out, you know, if it's a negligible, I don't know what the penalty is. Do you know?
I think, no, I don't know, but I'll find out.
Okay. See,
And,
I'll
and
look
so
at it
far,
again.
we have contributed over the 41 total, but we haven't spent it all. So, and
Okay.
I will, yeah, I'll look into that. That's what I needed to know. But so it would affect that HSA
Do
then.
you have you enrolled in Part A?
Yes. I have enrolled in Part A. I did that when I turned 65, but that's it.
Okay.
So that's the thing. It's
you
just
might get
Part
with
A. I haven't paid any premiums or anything like that. And so, and we've only had this HSA for 1 year. So yeah, I'll look into that.
are you planning to work for quite some time into the future, or what's your situation?
No, I just, if I can get some, I'm a tech person, so I'm just looking, I always do some part-time stuff, part-time gigs, and that's it. So I don't really look to work full-time. No,
Oh, okay. So you're really
pretty
yeah,
retired.
you're about to activate Part B and go on to full Medicare. So
Not necessarily. If it's going to hurt us, I won't do it yet. I mean, if I'll
okay,
wait another year, if I need to wait another year to do the Part B because of this HSA thing, I'll do that. And that's what I'll have to look into.
I
So
see.
otherwise, I would do the full on Part B and do the drug and the advantage. I mean, not the advantage. I don't want to do that. And
Right.
yeah. Um,
Sure.
so
You know, yeah, you're kind of in a tough spot there with those HSA contributions, but technically speaking, you would have had to you either need to back out the 4,150 or whatever's been contributed over the last 6 months
okay.
from your really my understanding is your Part A, whenever your Part A was effective. So
Oh wow.
that's
That
what
was
we
3 years
normally,
ago.
yeah, we normally consult with people, you know, with the HSA, it's tricky, it's different. So we normally tell people, you know, don't enroll in Part A when you're 65. If you don't have to, don't
Okay.
enroll in it.
Well, when I enrolled, we were still doing the PPO. We weren't in the high deductible. So we only did the high deductible plan this last year for the first time. And I had already enrolled in like,
Oh, I gotcha. Okay, sure. That makes
so
sense. Yeah.
yeah,
It's
so
just,
I was,
I'm gonna find that out for you. You've got I'm gonna
I've
put my
got your number.
email.
Yeah, I've got your email and your number. Or no, I
You
don't
got,
have your email. I just have your number.
here, I'm gonna send you my email too.
Okay.
Send me an email and what I'm going to do, I have a couple of CPA contacts. So I'll find out exactly what that penalty is for you, Pam.
Okay. Thank you.
And sure, when was your Part A effective?
In Oh, I don't know.
No, don't
It
worry
was-
about that.
it
Let's
was-
not
it
take
was-
everybody up on the
It
call
was
now.
3 years ago, right? 3 years ago.
Oh,
I'm
okay.
67. I'll
Great.
be 68 this year. I'll be 68 this March. So
Anybody else?
I think with that, we are over time. Marinella, do you have anything to wrap us up with?
No, that's all. We appreciate your time, Michael. Thank you. Thank you for all the questions that was brought up. It was very helpful, and we'll
Yeah.
post this on the website and we'll give everybody the links to it.
It was my pleasure to do it.